Welcome to the Wellness Equation, where we simplify health, break down the science, and help you design a life that works for you. I'm Dr. Uchenna Nyakura, and every week we explore ideas and help develop strategies that can help you close the gap between where you are and where you want to be. Now, you might know me from Fit Social. That era is over, and as you can see, I've made a few changes. Because this isn't just a podcast, it's your guide to navigating personal health, making an impact, and creating real, lasting change. Together, we'll balance the equation and reimagine what's possible. So let's dive in. Now, today, we're talking about something that's been making a lot of noise lately. GLP-1 drugs. These medications have taken the weight loss world by storm, and it's no surprise. They're convenient, they're effective, and they're changing the way that we think about managing weight and health. But before I jump in, I want to pause and reflect on something that's been on my mind. Recently, the passing of a United Healthcare executive has sparked a lot of frustration with our healthcare system, especially around insurance denials and access to care. Now, for me, honestly, this is a reminder of something that we kind of all know deep down. Our health system isn't always going to be there when we need it the most. And that's frustrating because the stakes couldn't be higher. I mean, it's healthcare. Now, if I sugarcoat what I'm going to say next, it would be irresponsible as someone who understands what these stakes actually are. But here's the reality. So much of the foundation of our healthcare starts with us as individuals. It starts with the choices that we make every single day. And we have got to take control of our health. It's not just empowering, it's essential. Because let's be real, the health system will fail us sometimes. Insurance claims, they get denied, and the fallout can be catastrophic. Over 60% of personal bankruptcies in the US, they're tied to medical bills. But all in all, this is why prevention is so important, because life is unpredictable, and there's no doubt about that. But what we can do is stack the odds in our favor by taking care of the one body that we've been given. Here's the bigger picture. A lot of the challenges that we face today, they happen because we're living in ways that just aren't aligned with our nature as humans. Because think about it. The animals that survive the best on this planet, they're not the biggest, they're not the fastest. They're the ones that adapt the most. The rule of the jungle is adapt or die. And that's been us. Humans have thrived because we're so good at adapting. But the environment that we've built for ourselves, it's working against us. We've created this era of abundance. It's a good problem, but it's a man-made problem, and it's making things harder. We're more sedentary, we're more individualistic, and we're more disconnected than ever. A lot of these advancements have lengthened our lifespans, but they've also taken a toll on the quality of that lifespan. When you look at things such as diabetes, obesity, and cancer, they're happening at record levels. But think about this. Don't diseases spread when they're caused by a bacteria or a virus or some other infectious agent? So how can diseases spread that aren't caused by an infectious agent? We expose ourselves to processed artificial food that's completely out of sync with what our bodies were designed to handle naturally. At the end of the day, we have to remember we're still animals, just living in a concrete jungle. And while it's a jungle that we've created, it's still a jungle. But here's the thing, we can adapt. And that brings us to today's big question. GLP-1s, are they really the revolutionary breakthrough that they seem to be? Or are they just another flashy health trend with really good marketing? So, grab your drink, settle in, and let's break this down together. Let's begin with the market. The weight loss industry has always been a multi-billion-dollar powerhouse, but the emergence of GLP-1s like Ozempic and Wegovy is reshaping the landscape. These medications aren't cheap, and depending on your location, a monthly prescription could cost you over $1,000 without insurance. And even with insurance, access isn't necessarily guaranteed. Yet, these drugs have quickly become some of the most talked about innovations in healthcare. Now, there's another dimension to consider: exclusivity. Many of these drugs, they remain under patent protection, granting manufacturers control over production and pricing. Now, let's examine what makes these medications so unique. GLP-1 receptor agonists were initially developed to manage type 2 diabetes, but during clinical trials, researchers observed a surprising trend. Patients not only experienced better blood sugar control, but they also began losing significant weight, sometimes as much as 20% of their body mass. And that's a transformative result in a field long in search of an effective solution. So, how do they work? These drugs mimic the effects of GLP-1, which is a hormone that helps regulate appetite. They essentially communicate with your brain to signal fullness, reducing calorie intake and, over time, driving weight loss. We seem to want healthcare to feel as effortless as flipping a switch, pressing a button, taking a pill, or injecting a solution. Six-pack abs in 30 minutes or less. New year, new me, starting on December 31st. But here's the reality. Even as something as simple as flipping a light switch depends on an entire system working in the background. You need a circuit to connect it, electricity to power it, a bulb to emit the light, and yes, you have to pay the bill to keep it all running. Our health works the same way. There are foundational processes that cannot be skipped or ignored. Certain steps that are immutable and necessary for lasting change. So it's no wonder that GLP-1s have captured so much attention. They're really the closest thing that we've come to a quick fix. And as a society, we're more than willing to spend billions to chase that promise. So, we're at a crossroads. Our environment, the one we've created, is working against us in ways that we're only beginning to understand. But what's the light at the end of the tunnel? Where does this current landscape leave us? GLP-1 drugs are undeniably a fascinating breakthrough in medicine, but let's be clear, they're not a magic pill. They're a tool. One piece of the wellness equation. And like any tool, they're only as effective as the user, as the system that they're part of. They work best when combined with balanced nutrition, regular movement, mental health support, and equitable access to care. The labels on these medications tell us exactly that. They're meant to be used alongside lifestyle and dietary changes. I like to think of them as training wheels. They provide the stability to get started, but the goal is to ride the bike on your own. As a physician by training, I've seen how much medicine can save lives, but I also know that it has its place. Medicine and holistic approaches shouldn't compete. They should collaborate. Both are tools in the same toolbox, working towards the same goal. And when you look at the root causes of so many health issues in our society, you'll notice a reoccurring theme: lifestyle. That's why I believe the real solution is lifestyle change. Medicine shouldn't be a permanent fixture in people's lives. It is an opportunity. It buys you the time to manage the most pressing risks while giving you the chance to build sustainable habits. But here's the catch. This only works when it starts early. Every choice we make is a vote for the kind of body we want, the kind of body we want to live in. And right now, we're casting votes for sedentary living, processed foods, overindulgence. Those votes have added up to the health outcomes that we're seeing today: record levels of diabetes, obesity, cancer, anxiety, and depression. And at the end of the day, There's something that we can't forget. We're still animals living in a concrete jungle. And while it's a jungle that we've built ourselves, it's still a jungle. And here's the truth. The animals that thrive aren't the biggest or the strongest. They're the ones that adapt. So now we have a choice. Will we adapt to the era of abundance, this man-made environment that's so out of sync with our biology, or will we continue down the same path, ignoring the tools and opportunities in front of us? The opportunity to change is here. It's in every meal that we prepare, every step that we take, every vote that we cast with our daily choices. The light at the end of the tunnel isn't just medicine or technology. It's us. It's our ability to adapt, to step back into alignment with what our bodies need, and to create the health and the life that we truly want. One decision at a time, we can reclaim the balance that we've lost and thrive in this jungle that we call modern life. So here's 3 takeaways that you can start applying today to get you to where you want to be, whether it's weight loss, weight gain, even if you want to maintain. 1, start with prevention. Take daily steps to prioritize your health. Prevention begins with small, consistent actions. Begin by focusing on the basics. Aim for balanced meals with whole foods. Incorporate more fruits, vegetables, lean proteins, healthy fats. Move your body daily, whether it's just a 10-minute walk, home workout, simply stretching, whatever. It doesn't have to be overwhelming. It just has to be consistent. Prioritize your mental health by finding ways to decompress, whether it's spending time in nature, meditating, or journaling. Number 2, educate yourself about your options. Know what's covered under your insurance and advocate for preventative care visits to catch potential issues early. Pay attention to what you eat, your physical activity, your mood, and any symptoms that you experience. This helps you understand patterns about yourself and equips you with information to discuss with your provider. Now, if medications like GLP-1s are something that you're considering, learn the science behind them. And speak with your doctor about how they fit into a broader plan that includes lifestyle change. And number 3, vote for your health with your daily choices. Every decision that you make is a vote for the health that you want. Instead of focusing on dramatic overhauls, start with small, sustainable changes. In place of a soda, add some water. Add a vegetable to each meal. Replace 15 minutes of screen time with physical activity. Create a supportive environment. Stock your home with healthier snacks. Or find a community or accountability partners to help you stay on track. Remember, adapting to this concrete jungle means making intentional decisions to align your modern lifestyle with your biological needs. These steps, they may seem simple, but over time, they build momentum for a healthier and more empowered life. So, that's it for today's episode, and what a great way to start the new year. My hope is that I've helped you reframe how you think about approaching your personal health. And as we continue exploring these topics, let's not lose sight of the human element. Behind every trend, every dollar sign, and every data point, there are real people striving to live healthier, happier lives. Many of the health challenges that we face are rooted in lifestyle choices, and addressing them requires cultural changes globally, valuing movement, prioritizing whole foods, and building a system that supports wellness instead of just reacting to illness. And there's also a vital need for a closer partnership between the science of medicine and the behavioral changes championed by holistic approaches. And let me clarify by what I mean by holistic. It's not about herbs and spices and, how to treat your cold symptoms with turmeric. It's about empowering behavior change. It's giving people the tools to strengthen their bodies, to improve their immune systems, and to reduce the impact of adverse health outcomes before they even occur. As health professionals, we should encourage this approach more actively because it's truly how we can lower the cost of healthcare over time. So, thank you for tuning into this first episode of The Wellness Equation. Now, if you found value in today's episode, I'd love for you to subscribe on my YouTube page, give me a like for the algo, or share it with someone who you think might find it helpful. And if you're ready to take the next step in your health journey, visit my website at reahealth.com and schedule a free consultation. Let's talk briefly and troubleshoot what you may have been doing already, especially if what you've been doing hasn't been working. Until next time, take care of yourself, make better choices that support your wellness, and as always, be well.